process going.
We're sorry about the link confusion. We began the live stream and then for some reason it ended. So there is a new link that was just sent out to everyone here just a few minutes ago. We're going to go ahead and begin. This live stream will be recorded and then eventually it will be posted on the website for other people to refer to. So we'll go ahead and begin. I'm going to introduce Stephanie Moore. She's one of the benefit consultants for Aaron Collins and Associates, and she oversees the Northwest Arizona Employee Benefit Trust group, the new group that we'll be moving to here come July 1st. So I will introduce Stephanie, and she will explain the presentation and the format of the presentation. And we are monitoring the email here at boardmeeting.org and boardmeeting@LHUSD.org. So as questions come in, we'll be monitoring those questions, and we will turn it over to Stephanie. Thank you.
Thank you, Mike. Welcome everybody to the open enrollment kickoff and transition information for Lake Havasu Unified School District moving into Northwest Arizona Employee Benefit Trust, affectionately now known as NAEBT. Mike mentioned that you will be able to ask questions during the presentation, and we're going to try to address those in a Q&A at the end. But if you have specific individual questions about your personal medical situation or a particular medication, whether it's on the formulary, we will answer those questions, but we're going to do that on a one-on-one basis in the next coming few days after the presentation. But we will try to address all of the general transition questions and planning and questions you may have. So with that, let's jump right in. So Northwest Arizona Employee Benefit Trust started in 2012, July 1, with the original 3 members, City of Lake Havasu, City of Bullhead City, and City of Kingman. So it is a self-funded plan that is authorized by Arizona revised statute where that allows entities such as cities, counties, school districts, fire districts, and other political subdivisions to come together and pool. So with economies of scale, rates can be kept lower. With the school district joining the trust, there will be approximately 1,600 employees on the plan and just over, well, somewhere over 3,000 noses on the plan. The trust is governed by a board of trustees. So it's a little bit different than what you're used to with your current board of trustees, where you have members of the public and employees that are on the board of trustees. This trustee board is made up of the city managers are the trustees, and in the school district case, it would be the superintendent, and then either HR managers or like the business director or manager of the school district would be the alternate trustees. So in the event that the city manager or superintendent can't attend the meeting, then the alternate would step in and vote on behalf of that entity. So what is self-funded? So you've been self-funded, but many times people really truthfully don't understand the concept of all of the contributions, whether they come from the employer or whether they come from individual members, employees on the plan. All that money is put together in an account, and that account pays for all the claims that come through and all the administrative costs associated with the plan. So the nice part about being self-funded is if claims come in lower than expected, it creates a surplus, and that surplus is kept by the entities inside the trust rather than become profits for an insurance company. So it's a very positive thing when things are going well. On the other hand, if things don't go well, but when you properly fund these trusts, you don't see this happen very often. You can be in a situation where there's a deficit and the entities have to contribute to make up the deficit. That has not happened in our pools, so we don't foresee that as being a problem. The trust is very careful about how they fund to make sure that that doesn't happen. So in a self-funded plan, every individual can actually make a big difference in the plan. So you may feel like your individual claims aren't going to make an impact, but in fact, your behavior on the plan does make an impact. So some of the ways that you make an impact is by shopping for the highest quality but lowest price care. That means going to in-network facilities, taking your medication when you're supposed to take it. All those things play a part in keeping costs low. The other thing that's really important is keeping yourself as healthy as you can be. So participating in on-site screenings to have that early detection of medical situations, and adopting healthy lifestyles and participating in wellness program that's activities, nutrition, staying educated, staying up on things, all make a big impact individually on the plan as a whole. So how does the trust or the pool create the rates that we'll be talking about later? So all the claims that come in are accumulated over the year and sent to the actuary on an aggregate basis, and the actuary takes into account the history of the claims, creating a pool trend, and then incorporates national medical and pharmacy, dental, vision trends into those actual claim trends to determine how much money the trust needs to collect from its members to make sure enough money is available in the account to pay for all the claims plus all the administrative services or administrative fees that are associated with running the pool. So this year, national trends were at 6 to 7% for medical and prescription drugs. NAEBT had a recommended increase of 2.4%. So you can see that with the claims experience, incorporating claims experience into a 6 to 7% trend, with ending up with 2.4, the trend for the trust was a negative trend to be able to bring that rate down. And that's truly the benefit of pooling like this. The more people that get on the plan, the more that those peaks and valleys of care and claim costs are flattened out. So since NAEBT's inception, they've averaged about 3.4% year over year since 2012. That doesn't mean that every year was 3.4%. Some years were 7 or 8%, but other years, many of those years were a rate pass. So the rate change didn't change at all. So overall, it's been pretty steady, and the kind of numbers that cities and school districts can budget without making a significant rate impact to employees. So I'm just going to hit the highlights of the kind of coverage that is offered through NAEBT that Lake Havasu schools will be participating in starting July the 1st. And then I'll provide a little bit more detail later on specifics as we go through the particular plans. So the network coverage is Blue Cross Blue Shield of Arizona, inside Arizona, and Blue Card or National Blue Cross Blue Shield coverage outside of Arizona. So you have literally national coverage which through Blue Cross Blue Shield, which is a huge network. They say that they have providers and facilities in every zip code in the United States. So we haven't checked that, but pretty sure they wouldn't put that out there if it wasn't true. Now, the one thing that is not included in that network for NAEBT and for Lake Havasu schools effective on July the 1st is the Mayo Clinic network. So Mayo is no longer going to be included in your network. So what does that mean for people that are currently using Mayo? It means that you will need to move to a non-Mayo provider or facility unless you meet certain criteria. So if you're in the middle of transplant care, if you're in the middle of cancer care, if you're in the middle of some complex medical situation, this plan does not want to disrupt your care. So let us know that you're in the middle of that care with Mayo, and we will talk to our case management about providing transition of care coverage for you to make sure that you can continue that coverage without that disruption. That doesn't mean that if you have a physical scheduled in August or you have less complex care that can be taken care of by a different provider, that you don't have to move. It just means that if you're in the middle of something complex, the plan wants you to maintain that care that you've been experiencing. So let us know if you're in that situation. So NAEBT offers two plans, much like you do now. High deductible health plan that offers both in-network and non-network coverage, and an EPO plan, which offers in-network coverage only. So in-network includes that nationwide Blue Cross Blue Shield coverage. So it's actually a very, very large, it's very large provider network. But if you wanted to continue to use Mayo on a non-network basis, you could enroll in the high deductible health plan, and it's subject to different separate set of deductible and maximum out of pocket, but it's available to you if you wanted to go that route. NAEBT offers one dental and vision plan as a bundle on two telemedicine plans, so Teladoc and Blue Care Anywhere, flexible spending, dependent daycare, and health savings accounts, life insurance and accidental death and dismemberment, and an employee assistance program for active employees and their household residents, and then a very robust wellness program. And we'll get into, like I said, a little bit more detail on these as we go through the presentation. So what do you need to know today to prepare for open enrollment? Your open enrollment is going to start April 27th, and it's going to run through May 15th. So that seems like a small period of time. It's about 3 weeks. But between today and May 15th, you have the opportunity to look in detail at the benefits guide that Mike sent out. And if you have any questions, reach out to Sherry in the Human Resources Department, or you're welcome to contact me directly or Bob in my office, and we'll be happy to answer any questions you may have about the plan or the transition. So this is what you would refer to as an active or positive enrollment, meaning that you have to enroll. So if you don't go on the iVisions portal and enroll, you will not have coverage on July the 1st. You must go in and enroll. And open enrollment is your opportunity to take people off your plan, add qualified dependents on your plan, change to a different plan, enroll in a flexible spending account, all those things. It's complete open season on enrollment versus, you can only do certain things when you have a qualifying event. Open enrollment, you can do anything. So who can you enroll in the plan? You can enroll your lawful spouse, and you can enroll children under the age of 26. Now, if you have disabled children that are currently on the plan and they're over age 26, they will obviously be allowed to be enrolled in the plan. However, if you have disabled children that are over 26 and they're not currently on your plan, you will not be able to enroll them on the NAEBT plan. For retirees, you can enroll the same people that are currently enrolled on your current plan as long as you have the documentation to support them being on the plan. So they must be legal dependents or your lawful spouse. And this is kind of a question for later on, but just something to plant in your head as far as if you are a qualified retiree, meaning if you were hired before July 1, 2005, and you've had continuous service with the district, and you are going to be eligible to go on to the retiree plan at some point, you can only enroll dependents on the plan as a retiree that you had on the plan on the last day you were an active employee. So if you're thinking about retiring this open enrollment period and you want to make sure that you can include dependents on your retiree plan, if you're qualified, this open enrollment would be the time to add them to the plan if you're thinking about retiring at the end of this school year. Not this school year, but the next school year. I guess I skipped a slide there. So part of enrollment is going to be dependent enrollment verification. So when you enroll your dependents on the plan, you will be required to provide documentation to Sherry in the Human Resources Department, documents that support their relationship to you. So if you want to enroll your spouse, you will need to provide a marriage certificate and the front of your latest tax return. It could be your federal or your state return. You can redact or black out all the financial information. Nobody needs to see that. If you are married and filing separate, that's fine. You still, at the top section, it tells you if you're married filing separate, what's your spouse's name and what's their social security number. That's that backup documentation. If you've been married, you have a marriage certificate, but your marriage certificate doesn't spontaneously combust if you're no longer married. So that's why we need two sets of that documentation. For dependent children, birth certificates or court orders, if you have adopted children or you have custody of a child or you have guardianship of a child, you'll have documents supporting that. Now, we're letting you know this now because sometimes these are not handy and sometimes you have to do a little bit of work to find them. And sometimes it takes longer than the time period that you have to get a copy of your marriage certificate or your birth certificate for your children if you don't have them readily available. You will have to complete paperwork and submit that to get that. And so if you're not able to actually produce the actual birth certificate, but you have documentation of the birth and you have paperwork showing that you've requested, paid the fee, there can be some leeway in time. So don't panic, okay? This is not about excluding people from the plan. This is about making sure that only the people who are supposed to be on the plan are supposed to be. And I know that seems crazy, but people actually do enroll a cousin or some other relative, a niece or a nephew, because they have significant medical issues and they don't have coverage. And that ultimately, while it makes you feel good, it hurts the plan. So you're putting, generally that doesn't happen unless there's some huge medical need. And so it ends up costing everybody more and eventually rates to go up. So what's new for Lake Havasu Unified School District starting July 1st? Practically everything, okay? So many things are changing. A lot of the things will be similar, but the vendors will change. So for your medical claims administrator, currently you have Gills Bar. Effective July the 1st, this will become AmeriBen. Now, Gilsbar will continue to process what we call runout claims. So the claims that are left over that occurred, the date of service was 6/30/20 or before, and AmeriBen will start processing all the claims effective with the date of service effective July the 1st. If you have questions about, or your provider has questions about eligibility, what's covered on the plan, those kinds of things, we of course are happy to help you with those questions. But the most direct and quickest way to get an answer is to go direct to My AmeriBen. So you're going to call AmeriBen at the customer service number. It'll be on your insurance card. It's in the benefit guide. And you'll be able to register for access starting July the 1st. So you'll be able to see all your explanation of benefits, all of your accumulators, and all of that information will be on that My AmeriBen site. And if your provider has questions about eligibility or how something would be processed, or whether it would be on a copay or deductible and coinsurance, AmeriBen is going to be their best resource, because they're actually looking at the plan bill while they're on the call with the member or the provider. We're happy to help too, but if you send it to us, we're going to contact AmeriBen and we'll get the answer and we'll get it back to you. But the quickest and most direct way to get an answer is to contact AmeriBen directly. Now, the same thing goes for your pharmacy benefit manager. So currently you have CVS Caremark, and you'll be moving over to Navitus effective 7/1. So pharmacy is a little bit different in that there is really no such thing as runout claims. So you pick up your prescription on 6/30, it's going to get billed on that day, and there shouldn't be any issue with that. The biggest thing that I find when we change pharmacy benefit managers is that even if you present your new card to the pharmacy, many times they don't actually put that information into the system. And so if your claim comes back denied in those first couple weeks, make sure, again, if they say, I'm sorry, it's not going through, they can contact Navitus directly right there, and they will guide them through the process of making sure that everything is set up properly for your claims to process. So starting 7/1, you'll be able to go to navitus.com and register so you can see how your claims processed, what the total cost to the trust was, what your contribution was, and they have tons of information on the site. So Costco Pharmacy will now be your mail order pharmacy, and you will need to get a new prescription if you're utilizing mail order. So this is a good time to get that plan in advance. And especially given the circumstances that we're all in right now, that extension exists to get a fill early. So if you have any concerns about being able to fill right in that first week, shouldn't be a problem. But if it helps you sleep better at night, get an early fill of your prescription in June for July, and then it should be an easy transition for you. Specialty pharmacy will be through Lumicera, and everything will go through Lumicera except for there are certain specialty drugs that you can only get through Walgreens and specialty, but Navitus handles all of that for you. So it's same process that you go through now, except the claims go through Lumicera. So you may be wondering, is the formulary, will my drugs change, what's approved, what tier they're in? We can't know in your individual situation, but just to give everybody a little bit of peace of mind, and for the transition period, all members coming onto the plan have a 6-month grandfathering period. So no matter what you're taking, it will fall into, if it's currently a brand name drug, it'll fall into a brand name drug on the new plan with that copay. If it's generic, it'll be generic at the same copay, even if it's not on the formulary, to give people that opportunity once they have access to Navitus and the staff there to walk their provider or them through what's available. They have a full 6 months. And many people look at that and they think, well, this is maybe going to be bad, or this is going to be a negative thing for me. You may find that a medication, a brand medication that you've wanted to take is on the Navitus formulary and you haven't been able to take it because it's not on the CVS Caremark pharmacy or formulary. Now for specialty, folks on specialty meds, and those folks will have a full year of grandfathering, and it could end up being lifetime. It depends on what they're taking and how complex their situation is. So many times, and many of these specialty meds, you can't just take somebody off of them. You have to wean them off and put something new in their place, and sometimes it can be detrimental to their health. So the plan has no interest in putting anyone in that situation. So, but the folks at Navitus who are clinical pharmacists will help make a decision regarding that. So none of us that don't have that level of expertise will be saying to somebody, I'm sorry, you have to switch medications. So the other thing is, if you're in a situation, so even if you're in that 6-month period for your regular brand name or generic drugs, but you've tried everything under the sun, and this medication that you're on is the only thing that works for you, there's a process called prior authorization. Every plan offers it, that allows you to go through that process with the pharmacy benefit manager to ultimately get that approved or not approved, depending on working with your provider, your physician, to see, is there something else that's on the formula that it could be on? Or if you've tried and failed all of the medications that are on the formulary, they don't work for you, then those clinical pharmacists at Navitus will make that decision if it should be grandfathered permanently. So dental, so your vendor will be the same. You'll still have Emeritus that is processing your dental claims, and you'll still have the Emeritus network for your dentist, so you shouldn't have any issues in that area. The NAEBT plan only has in-network Emeritus coverage, so there is no non-network coverage. The only thing in this is that, so orthodontia in process, if you're seeing a non-network orthodontist, they'll let you continue that coverage till the end because it's a certain amount. So it's fairly typical, 100% twice a year for cleanings and those kinds of routine things, 80% on type 2 and type 3 benefits. I'm sure it's very similar to what you have right now. And there is a lot more detailed information in the benefits guide, but the maximum per year is $3,000 per member on the plan, so it's a very healthy benefit, and we actually don't have many people that run up against that benefit. And we always recommend, if you're looking at some really big process, if you have it done in May or June, you can finish it up in July or August, and you get $3,000 in this plan year and $3,000 in that plan year, so you can kind of make it work. The orthodontics benefit is $1,000 lifetime. So vision is changing. Vision is also administered by Emeritus. They are the claims payer and processor, but the network is VSP. So VSP is widely accepted in this area, and I can tell you, as you know, Lake Havasu City employees have this plan. We don't have any problems with members not finding enough providers in the area, so I don't think this should be a problem. So $10 for the exam deductible, and the rest is covered. $105 for frame allowance, and then single, bifocal, trifocal, lenticular, all covered in full unless you want progressives, and then there's a copay that goes with those progressives. So then $150 for contacts if you want to wear contacts instead of having glasses coverage, And then you can get the exam, lens, and frames every 12 months. So life insurance is also changing. And this is kind of there's some negative and there's some good stuff when it comes to life insurance. So you have Guardian currently for life insurance, and you'll be moving to the standard for your life insurance. For the employee, and the basic life insurance is covered at 100% by the district. Employee $40,000 left for life insurance and $40,000 in accidental death and dismemberment. Now this could be lower than what you're currently receiving because the district benefit now is 1.5 times your salary, your annual salary. So this could be a reduction for some folks. Spouses, though, is an increase to $10,000, and eligible children are $5,000. So, and that is also an increase from the existing coverage. For retirees, the district is contributing a portion towards $20,000 in life insurance and $20,000 in accidental death and dismemberment. Now, this is where, when we move into voluntary life, this is where we see a really positive situation. So if you have voluntary term life now through the Guardian, that is moving straight over if you want to keep it. So if you have $250,000 in term life, it's already approved on July 1. It'll be in effect through the standard. But the standard has gone one step further because NAEBT's plan allows for new enrollees guaranteed issue coverage. So employees can have up to $100,000 in guaranteed issue. Spouses can have up to $20,000, and children can have an additional $5,000 or $10,000 in guaranteed issue coverage. What the standard has said is they're going to make this effective for Lake Havasu Unified School District employees and dependents coming onto the plan. So just like as if you're new employees hiring on, if you do not have DTL right now, you will be able to enroll without medical underwriting for these guaranteed issues. So if you have $20,000, $30,000 of VTL and you want $100,000, you have that $30,000 in that's going to transfer over. You're going to apply for a total of 100, and you're going to get it because it's guaranteed to be issued. So this is a very positive thing for folks who haven't been able to be approved through the Guardian or didn't think to get it when they first enrolled. So I'm going to spend just a few minutes talking about the two different plans. The first one is the high deductible health plan. High deductible health plan provides in-network coverage after the deductible, basically 80-20 until you hit your max out of pocket. Now, if you're employee only on the high deductible health plan, your deductible is $1,400. If you are anything other than employee only, your deductible is $2,800. The out-of-pocket maximum on the high deductible health plan, if you are employee only, is $3,000, and if you are in any other tier besides employee only, it is $6,000. So then this plan also has out-of-network coverage, so it has that same $1,400, $2,800 deductible, but the out-of-pocket maximum is unlimited, so there is no cap. This plan with nationwide Blue Cross Blue Shield, there's very little need for anyone to go out of network. And as with all medical plans, if you have an emergency situation and you end up in a non-Blue Cross Blue Shield facility, it's covered as a network. So this would be a conscious choice to go out of network. And anytime members go out of network, it always costs the plan more. So in this case, the plan has decided, since that nationwide network exists, we'll share the cost as long as you continue to decide to use out-of-network coverage. So then looking at the exclusive provider organization, or the EPO, it only has in-network coverage. So there is no out-of-network coverage, but that in-network coverage includes Blue Cross Blue Shield nationwide. The plan year deductible per participant is $600. So, and the family maximum is $1,800. So if you have 5 people in your family, you hit 3 $600 deductibles, you're done, okay? Or you hit $1,800 total out of all the people in your family. Once you hit that $1,800 in deductibles, you've paid your deductible. And then the plan for major medical pays basically 80-20 up until your max out of pocket. So the maximum out of pocket, if you're a individual person on the plan, is $7,900, which is exactly the same amount that you have on your current plan, except that your current plan splits out medical from prescription. And then the family max is $15,800, which is the same as what you have now, but again, your current plan splits it between medical and prescription. Office visits are $30, and specialists are $50. And that carries across behavioral health, chiropractic, everything. So if it's a psychologist, nurse practitioner, social worker, physician's assistant, physician in the office, $30. If it's a specialist, physician or a psychiatrist, it's going to be $50. The urgent care copay is $50. Emergency room is $150 copay, and no deductible, or and then 80% after deductible. So then, after all those deductibles or copays, the plan generally pays 80-20 up to those maximum out-of-pockets, and there is no out-of-network coverage. So this slide shows the rates. So you have your same tiers that you have on your plans right now, and then the next column is the total monthly premium for medical and prescription plan. The next 2 columns are what the school district is contributing depending on what your pay schedule is, 24 pays or 18 pays. And then the last 2 columns are what your contributions are going to be for your dependent coverage, depending on what your pay schedule is. And you can see that the district is paying 100% of the lowest employee-only premium. So that would be the high deductible health plan. So that's the amount, well, actually, I guess you're paying 100% of both for the employee only. So, and you can see that the district is making a healthy contribution to dependent coverage to encourage families to put your dependents on the plan. The more noses that are on the plan, the better it is for everybody, especially children. So as the plan moves forward, we hope to see more and more dependents coming on the plan. The next slide here is dental vision, and it follows the same format. The first column is the combined dental vision premium, and then what the employer will contribute depending on your pay schedule, and then what your employee contribution will be pre-tax to cover your dependents. And again, the district is covering 100% of the employee-only premium, and then making an additional contribution for your dependents. And then when we get to life and AD&D, the district is covering all the basic life at 100% for you. So no change there. So dental and vision are bundled. And I think I said that before, but you can't opt to be in one and not the other. They are bundled together. So you have to be in both. With that being said, if you want to enroll in medical, but you don't want to enroll in medical dental, you don't have to. Or if you want to waive medical because you're on your spouse's coverage, but you want to take dental vision, you can do that. So it's not all bundled together, but these particular coverages are bundled with each other. Voluntary term life is 100% paid by the employee. So then this slide is the retiree rates. So you will notice that these rates are considerably different than the active employee rates. So in the past, there was a combined rate, consolidated rate between retirees and the active employment and the actual active employees. As part of a requirement that NAEBT stipulated with the school district joining, the retirees had to be on a self-supporting rate, meaning that the active employees are not subsidizing the coverage for the retiree participants in the plan. So their rates are higher because retirees typically have both frequency and severity of claims. So more claims and more expensive claims than active employees do. So these rates are higher than the active employee rates. So the district contribution was determined by taking 70% of the lowest retiree only premium, which was the high deductible health plan. And then the balance of that 70% is paid by the retiree. So there is also no contribution on medical RX for retiree dependents. And that carries forward all the way through until we get, and it now includes the life insurance premium. So the $4 that the $20,000 of life insurance and the $20,000 of accidental death and dismemberment is now split 70-30 between the district paying 70% and the retiree paying that 30% that's left over. So looking at the prescription plan, first looking at high deductible health plan. So as part of healthcare reform, the federal government came out with a list of medications that had to be required with zero cost sharing, and it's for everyone, no matter whether you're on high deductible health plan or the EPO, those things are covered. And you can see the list of those if you go to healthcare.gov, or they're the standard ones that are out there. But the next step was that NAEBT saw that one of the fear factors that members had about moving to the high deductible health plan was that I'm basically in a stable medical condition, but I take a maintenance medication every month. And that maintenance medication might be $300, the prescription. So I don't want to go on the high deductible health plan because I'm better off paying a copay on the EPO than I am paying that full $300 a month until I hit my deductible and then pay co-insurance all the way up to my maximum out of pocket. So what NAEBT did was, there is an expanded list that the federal government said, this is an option. You can do this if you want to do this, but you don't have to. It's all those maintenance medications like thyroid medication, insulin, and those kinds of things are on that list. And you can get those medications with zero cost sharing through this plan on the high deductible health plan. So there is a list of those drugs, and we can provide that to you if you want to see if your medication is on there, but it is a big list. And for many people, you will find that this makes the difference of whether you're better off financially on the high deductible health plan or whether you're better off to stay on the EPO. Because there's not very many of you that are currently on the high deductible health plan, but you may find that this makes the difference. So then looking at the normal everyday drugs, generic drugs are 20% after deductible. All of them are except for tier 3 drugs, and those are your non-formulary medications. And you might think that's a typo, but that is not a typo. The member would be responsible for 75% of the drug cost. And that is because the formulary that is in existence, Navitus has a lowest net cost method of how they determine what goes on the formulary. So they're looking for the most effective drugs. They're going to cost the plan the least. So if you choose to not take any of the formulary drugs, not because you can't, but because you choose to, then the plan says you can make a higher contribution towards that. And the folks that go on the drugs that are going to cost the plan the least are going to get the best benefit. So these are the kinds of things that keep your premiums low over time. So they may seem a little bit harsh, but the intention is to keep your plan affordable so that you can have your whole family on the plan. And then specialty medications are 20% after deductible. So if you're at 90, a 90-day supply, either available through your retail pharmacy or through mail order, is pretty much the same, 20%, 20%, and then 75%. You don't get specialty medicines on a 90-day prescription, so they're not listed here. So moving over to the EPO for the prescription plan, it does include all of the drugs that are required by the federal government to be covered with zero cost sharing. Of course, it covers those. But that expanded list that you may see is the normal copays go along with that. That is only covered at zero cost sharing for the high deductible health plan members. If you're on the EPO, generic drugs, 30-day supply are $10. Preferred drugs are $30. Again, non-preferred drugs are 75%. And then specialty is 20%, not to exceed $150. And then a 90-day supply is 20, 60, and then the same 75. NAEBT is just instituting a program with NAEBT called Copay Max, and almost all of the pharmacy benefit managers are doing this, and the intent of the plan of that program is to maximize the manufacturer's coupons that are available to members. So if your drug qualifies, it's only specialty medications. If your medication qualifies for copay assistance and it's specialty medication, your copay will be zero, okay? And Lumicera will work with the manufacturer to maximize that contribution so that, but you will pay zero. So it can end up being a very positive thing, and that's on both plans. All right, so you're probably wondering, what is going to be the best plan for me financially? And I like to look at it more big picture than looking at those individual coverages all through the plan. So let's just take a look at the very basic information, deductibles and maximum out of pocket, because literally those are the keys in how affordable the plan is going to be for you. So on the high deductible health plan, we talked about the deductible is non-embedded, meaning that if you're employee only, you have the $1,400, and if you're anything other than that, it's $2,800. So then now let's shift over to the EPO. $600 per participant, up to $1,800 for a family. So right out of the gate, you're thinking, how could the EPO be bad, right? This looks so much better than paying the first $1,400 or $2,800 of all of our claims. But when you look at the maximum out of pocket, this is where it really makes a difference. So on the high deductible health plan, yes, if you're an individual, you're paying the first $1,400 of your claims and then 80/20, but your maximum is going to be $3,000 if you're an employee only. So shifting over to the EPO plan, if you're an individual, your maximum out of pocket is $7,900. So more than twice what it is on the high deductible health plan. If you're anything but employee only on the high deductible health plan, you're going to pay the first $2,800 of your claims. So that seems like a big number, right? But again, the district is making a contribution to your HSA, which we'll get into a little bit differently, and hopefully you're contributing to your HSA on a pre-tax basis. But if you look at your maximum out of pocket as a family, $6,000. So your whole family's maximum out of pocket is less than the single participant on the EPO. And I'm not here selling the high deductible health plan. I'm just saying there's a major fear factor about moving to that plan because of having to pay those upfront costs. And it just depends on how you want to pay it. If you sleep better at night, knowing that you have a copay, and the only time you're ever going to have to pay that coinsurance is if you have a major medical situation or need advanced imaging or something like that, and if it helps you sleep better at night to stay on the EPO, then that's what you should do. But if you have a medical situation and you are currently hitting your max out of pocket, you should consider the high deductible health plan. And if you are a saver and you're the kind of person who can put away $100 a month towards your HSA plus what the district contributes to you, you have your deductible covered. And if you don't use it this year, it rolls over into future years. So definitely look at this. None of us are going to tell you which plan you should be on. That's an individual decision. But as you go through this time before May 15th, if you have questions about how the plans differ or how it would figure out in your individual situation, we're happy to help you walk through that scenario to decide which is going to be, at least provide you the information so that you can make an educated decision about where you'll feel most comfortable. We hit embedded versus non-embedded, but this is the high deductible plan is non-embedded because the federal government says that to be embedded, meaning that everybody has their own individual deductible and max out of pocket. And when you hit your numbers, everybody's covered. The minimum that it can be is $2,800. So that's set by the federal government. So because NAEBT chooses to have those lower thresholds of deductibles, which are the minimums that the federal government allows, because they choose to have those lower numbers, those deductibles cannot be embedded. So just keep that in mind. If you're employee only, it's $1,400, and if you're a family or anything other than that, it's $2,800, and then the max is $300 or $3,000 and $6,000. So that's the only difference. And then on the EPO is embedded, meaning that it's $600 per person until the whole family hits $1,800, and then each individual member, once you hit $7,900, you're done paying. The plan's paying 100% of approved charges after that. So a couple of reminders for you. Again, eligibility questions, claim processing questions, all of those things. I would recommend you contact Ameriben directly starting 7/1. If you have questions before then, definitely reach out to me. Your folks in the Human Resources Department will be experts very soon, but with the changeover from one plan to another, your best resource in the beginning, at least, is going to be to come to ECA. We'll be happy to answer those questions that you may have. One thing that's not changing is American Health Group. That's your current pre-certification and case management company that's handling your situations now. So that's going to continue on. That won't be changing. If you are currently on case management and you work closely with one of the nurse case managers, that nurse will continue to be your case manager when you move over to NAEBT. So you won't be making a change there, which is kind of comforting when you're going through one of those complex medical situations. So a little bit of time on high deductible health plans and HSAs, and I know we're going long here, but I told everybody this before. I am an expert at giving long answers to everything. I'm also an expert at giving long presentations. So I apologize for the time, but I want to make sure I give you enough information to at least know what questions to ask. So a high deductible health plan, premiums are generally lower, and in this case they definitely are. HSAs have a tax favorite. They're triple tax favored. So they come out of any contributions you make or your employer makes come to you pre-tax. Any interest that the account makes while it's there at the bank, the interest is tax-free. And when you use it, it's also tax-free. Ultimately, so different than an FSA, on your HSA, your funds roll over year. It's not a use it or lose it situation, so it continues to roll over. And that money actually turns into, when you become legal retirement age by the federal government standards, that money becomes like any other retirement account. If you want to use it for regular income, you just pay regular income tax on it like you would an IRA or any of those types of accounts. But I think we can all agree that as we get older and we move into retirement, that we're going to have plenty of medical costs. And if you use it consistently for medical costs, including Medicare supplements, or you can use it to pay COBRA premiums, all those things. I think we can all agree that there's an opportunity to never pay taxes on this money. But it is available to use as regular income once you hit retirement. Otherwise, if you use it for non-qualified expenses before, then there's the penalty and taxes associated with it. So what's listed here is the common things you can use it to. You can use it for deductibles. You can use it for copays if you're on the EPO plan. You can use it for your prescription costs, dental expenses, eyeglasses, all those kinds of things. And then the federal government just authorized both HSA and FSAs to be used for non-prescription drug costs, as long as those, so typically not supplements, but things that are used for an illness, like cough syrup and those kinds of things. So pretty much all took care of all of those things. So with your HSA account, which will be moving if you currently have an account, an HSA account through Healthcare Bank, that will be shifting over to HSA Bank. And we're going to provide you the paperwork to roll over any funds that you have, so that there's no tax implications. That money will just move straight over from Healthcare Bank into HSA Bank. And new accounts, you'll open a new account with HSA Bank. It's a wonderful HSA carrier. You can actually take chunks of your money after you accumulate some and put it in mutual funds and different ways if you want to expand your investment horizons with your HSA funds. You'll get a debit card that you use just like FSA if you're enrolled in that, and it's super easy to use. So HSA's maximum contribution is $35.50 for an individual, plus $1,000 if you're over 55, and then for a family, $7,100 plus $1,000 if you're over 55. The district will contribute the difference between the cost of the EPO plan for an employee only and the cost of the high deductible health plan, which is $687 in equal installments in your HSA account for you, depending on your pay schedule. So in 24 payments or in 18 payments. All right, let's talk about PREO. So this can be a really confusing thing, and I'm just going to hit the highlights of it because I'm going to recommend to you that if you are one of those employees that was hired before July 1st, 2005, and you're not entering a PREO contract in the next year, that just prior to you moving into a decision of whether you're going to utilize the post-retirement employee option, I recommend a conversation at that time with either your HR staff or ECA so that we can talk in detail about the pros and cons of which decision you make. But the basic, so the reason that things are confusing now a little bit is because of the difference between the retiree rates and the active rates. So the retiree rates used to be the same as the active rates. And the school district was looking for a way to preserve a lower rate for members that were moving into this PREO program. So COBRA is the way to do that. But there's a couple of things that you need to know before you opt to go on COBRA. So if you have been approved to participate in the PREO program and you are qualified to utilize the retiree the plan, so you've been hired before July 1st, 2005, you can go on COBRA when you terminate and you retire from the school district, and go on COBRA, and the premium is 102% of the active employee rates. And the district will make the contribution that they would have made to your retiree premium to that COBRA rate. Now here's where it gets a little bit iffy for people. So you can stay on COBRA for a total of 18 months. You have 1 year, as required by the Arizona State Retirement System, to stay off of the regular payroll of the school district. So you have that 12 months. Then the school district would rehire you, and then you would have your waiting period before your benefits would kick in, all which easily happens within that 18 months. But, so if it happens just like that, that's great, right? You get rehired, you go back on the active rates for employees, and then when you decide to final retire, you retire, you go on the retiree rates, and you can stay there until you're age 65. But what happens if you don't get rehired? What if you've robbed a bank in the interim and you no longer qualify? You cannot successfully be rehired by the district. Or you choose not to come back. Like that last year that's it, I'm done, right? You have now forfeited your right to be on that retiree plan. So this is something you have to really think through when trying to decide whether to save money and go on COBRA, or whether when you retire and do your PREO year, do you just go straight to those retiree rates? So if you go straight to the retiree rates and you decide, I'm not coming back next year, you're on there. You don't have to worry about it. You're already on the retiree plan and you can stay there as long as you continue to make your contributions until you hit age 65. If you decide to come back, you get rehired, you have your waiting period, you still are on the retiree plan, and then you shift over to the active plan. So again, or I guess you wouldn't even have a waiting period. You just, as soon as you're eligible, you would shift over to the active plan. And then when you final retire again, you go back on those retiree rates. That preserves your right, so it gives you that option. If you opt for COBRA and try to save some money in that year, and you don't come back, you will not be able to come back on the retiree plan. So it's just something, and if you're not retiring this year, this is just something I'm telling you, when you get ready to do it, when you're thinking about where do I go from here, that's the time to sit down and have that conversation. And make sure that you understand what's going to be the best for you in the long run. So I'm not going to go into all the requirements for PREO. That's really a district thing, but you have to be approved to do it, and you have to meet certain requirements. And that is all on you all. I just want to make sure that Everybody understands that's going into it this year. If you want more detailed information, contact me directly. Mike, Sherry, anybody will be able to help you at least provide enough information for you to make a decision how you want to proceed. So one of the last things I want to talk about is NAEBT's wellness program. So this is a very important thing to this plan. And I hope that you will be as excited about this plan as the rest of the folks on NAEBT. So NAEBT offers a very robust wellness program. They have on-site screenings that include health risk assessment and biometrics, flu and pneumonia vaccines on-site, 3D mammograms on-site, prostate exams, colorectal cancer screenings, comprehensive eye screenings, cardiac and organ screenings, and skin cancer screenings that will all be conducted on-site at the school. So lots of great screenings, and they're looking at more. So hearing screenings, on-site dental things, they're looking at all kinds of different opportunities to bring on-site to help people get the preventive care that's so necessary to offset, get early detection on things and take care of the little things that we all tend to put off. So they're kind of switching over right now. They have a portal, they're not happy with it, so they're looking at investing in a very full, well-rounded portal that is full of activities and has programming that will be tailored to each individual participant. So if chronic disease is if you have an area and you're just trying to get a little bit more active, the program is designed after you complete the questionnaire to kind of filter appropriate things for you to do. So you're not going to get do 100 burpees and that kind of stuff. Like, that's great for some people, but if I went on a program and they told me to do that, I would go. But good nutrition information, lots of feedback, perhaps health coaching, all kinds of things, the portals that they're looking at if you want to go take a look and provide your opinion of what you think would be good. Virgin Pulse and the Humana Vitality programs. So they're very good programs, and they are very diverse. So lots of stuff from every fitness level, from every nutrition level, for all kinds of activities and everything. So I think that either one, and they're looking at a few others, but these are the top ones on their list. And then another thing that NAEBT has done for the last couple of years is they bring chair massages on site a couple times a year, because like working in city government, working for the school district, you probably have a lot of stress, and this just a really positive time a couple times a year. We usually do it, but it might not work at their schedule for your schedule, but we'll make it work when the most of you are available in those days. So this is the moment you've all been waiting for, the wrap up. Your open enrollment begins April 27th. Enroll or de-enroll or re-enroll in flexible spending or your dependent daycare account. You will get new medical RX ID cards. They will come to your home address, so be watching for the envelope. And I like to recommend people to open all their mail, just so you can decide whether it's really junk mail or not, because your EOBs will come that way, and important plan information, wellness information will come to your home address. But you will be getting a new insurance card. If you need more cards than you receive, you, starting July 1st, you'll be able to go register directly on the MyAmeriBen site and request your own cards. Sherry will be able to do that for you. I will be able to do that. Bob in my office will be able to do that for you. AmeriBen will be able to do that for you. But the easiest way, and you'll also be able to, there's an app from My AmeriBed that you'll be able to have your a digital ID card. Your dental vision cards, you will have new cards. There'll be one for dental, one for vision. Everybody will get new cards. So be on the lookout for those. I do not know how they will come yet. We're trying to get them mailed to your homes, but in the case that you can't, it will come through the district. And all the changes that you want to make need to come through the iVision's open enrollment or the enrollment portal. So with that, ready for questions?
Okay. We don't have very many at the moment, but I'm sure they'll start coming in. So first question was if our spouse has been on our current plan, do we need to submit marriage certificate and tax returns?
Yes. So anybody that you put on your plan as a dependent, either as a spouse or as any other dependent, everybody must have documentation besides you, the employee, must have documentation to remain on the plan.
And so just for internally and also for everyone who's listening, how often do we conduct such an audit? This is kind of an audit process as well. So how often do you recommend this occur? During every open enrollment?
No. So we recommend every 3 to 5 years. And this is something that's not exclusive to Lake Havasu School District. It was also done just a couple of years ago by all the NAEBT participants. So we do recommend every 3 to 5 years doing this to make sure that only those that should be on the plan are on the plan.
And you would also recommend we do this for new hires who are coming in mid-year or whatever, they would have this documentation with them when they elect a plan.
Correct.
Okay. Another question was, will I be able to keep my doctor, eye doctor, and dentist?
So if your doctor is a Blue Cross Blue Shield provider, yes. And since the Lake Havasu School, your current plans are also Blue Cross Blue Shield, it's highly likely that you will be able to keep your provider. The only ones that really are of concern are Mayo providers. So that we would need to look at. For dental, if you are utilizing an emeritus network dental provider, that will just no problem. But if you are utilizing a non-network or a non-emeritus network provider, you will have to switch over to an emeritus provider. And then VSP, almost all of the optometrists in town take everybody. So I doubt very much that you would have a vision provider that you would have to leave.
Okay, just a clarifying question. So can I opt out of medical and prescription and enroll in dental vision only?
Yes.
So that's something that's new to us here. So in order to have dental and vision coverage, you had to have medical coverage. So that is something that's different with the NAEBT. With the NAEBT structure, you do not have to have medical and prescription coverage in order to have dental and vision.
Correct.
Okay. Another question, is there a preferred pharmacy?
No. You can go to any pharmacy, but I will tell you that some pharmacies are less expensive than others. And it's a good idea. It gets a little bit confusing when you go on GoodRx, but if you go on goodrx.com, it gives you an idea of the different costs. So you can look up a particular drug and see how it varies from pharmacy to pharmacy. Sometimes you can get a prescription for less paying cash than you can for your copay. I would encourage you to do that if it is a benefit to you. Every pharmacy is included in the network. So there's not really a network when it comes in. There's no penalties to go to, like sometimes there's a penalty if you go to a Walgreens versus a CVS. this plan doesn't have any of those penalties.
Another question is, how do we get that expanded preventative list for pharmacy?
We can provide it to you and you can post it. Or we can email it to you if you send an email to me.
And then we can send it out to everyone?
Yep.
Okay. Another question would be voluntary life insurance and moving that over. Is that true for retirees and retirees who COBRA?
So life insurance is not a COBRA-able, I don't know if that's a word. It's not a COBRA coverage. So if you go on COBRA, you can, if you have voluntary term life, you can convert a certain portion of it into, so it's portable, but only a certain portion of it is portable. If you go on COBRA, you will, unless you port some of it, you will lose that coverage. If you move to the retiree plan, your VTL can stay in place.
And then another question is, how do we contact you for questions?
I knew somebody was going to answer that. So my email is stephanie.m@ecollinsandassociates.com. And that information, because that is just the most ridiculous email address in the world. But if you remember, I mean, hopefully you remember your current consultant, Jamie. She's Jamie S., same email address. All the information on how to contact me is in your enrollment guide. It's listed under the vendor contacts for how to contact me, how to contact the group benefit specialist that's working with this group, Bob, and either by telephone or by email. And my office phone is, because we're working from home right now, my office phone is forwarded to my cell phone. So if you call, I will get your call. So even if you get like funny voicemail, because it's my personal number, just leave a message, I'll call you back. But during business hours, I'm answering that phone all day. So just give me a holler and I will get back to you with whatever your question is.
We also had another question, kind of a scenario question here. So my current coverage for spouse additional life exceeds the $20,000 guarantee. But you stated that current coverages will be automatically transferred. So $50,000 is the current coverage. Will I be able to keep that coverage for my spouse, or do I have to go through additional qualifications to keep that coverage amount?
So anything that's currently in place will transfer over. So if you have $50,000 on your spouse, that coverage will be in place if you want to keep it on July the 1st. And the rate schedule for that coverage is in the benefits guide. So you just want to look at it to make sure. I'm not sure how it compares, but it's these voluntary term life are always very low rates. But if you have $50,000 now on your spouse, that $50,000 transfers over on July the 1st.
So the coverage stays the same, but the rates will probably differ.
They may be higher or lower. I don't know off the top of my head.
I believe that's all we have.
There's another one.
Is there another one now? Okay, another question. Can you repeat what the district will contribute to the HSA for a family if you join the high deductible plan?
$687, regardless of what tier you're in. So if you're on the high deductible health plan, and that number was determined by looking at the district's contribution for employee only between the high deductible health plan and the EPO. So the EPO premium is higher. So just that difference there to make it even Steven, the district contributes that $687, depending on your pay schedule, either in 24 installments or in 18 installments or contributions to your HSA.
There was a question regarding retirees, but it looks like we're handling that internally as far as, I'll read the question. It says, when is open enrollment for a brand new retiree? I am not PREO. Do I wait for our benefits department to contact me, or do I complete the enrollment when everyone else does in the next 3 weeks? It looks like that our benefits individual will go ahead and reach out to you specifically, to those who are in that scenario or that circumstance, and we will walk retirees through that process, those who are not returning for PREO. Okay, it says, can you verify that the HSA rolls over?
Yes, and technically it's called a transfer. So typically a rollover would come to the individual, and the individual would be responsible within a certain amount of time period to get it moved into another account. What we will do is the school district is working on setting up the employer side of the account with HSA Bank. I have the forms already in my hot hands to give to you when the time is right to transfer that money directly from your existing account into your new HSA Bank account, and it just transfers over there seamlessly. It does take a little bit of time, and you can literally do that anytime, but you will want to wait until, if you have a contribution coming in from the school district, you will want to wait until your last contribution comes in so that it can all be transferred over at the same time. Or if there's a little bit of money left in there after you make a transfer, then you just make a purchase, and then we'll get those accounts closed out. But yes, transferred, no tax implications. Transferring it from one HSA account directly to the other.
And HSA is linked to the high deductible health plan only, correct? Okay, so if you're electing the EPO plan, you cannot set up an HSA.
Right, you can have a flexible spending account, and that's detailed in the benefit guide. I always encourage everybody, if you have any medical expenses during the year at all, no matter what plan you're on, either participate in the FSA or into the HSA, because it doesn't, even if you pay $10 a month for a prescription, why wouldn't you want to spend that $120 pre-tax? Just makes good sense to participate, and you can always spend whatever that is on qualified expenses. So I just encourage everybody to not pay taxes.
Do both plans cover outside of Arizona?
Yes, both plans have Blue Cross Blue Shield nationwide coverage.
And I believe this was answered already, but just again, does HSA have to be spent each year?
No, it rolls over year.
I have one more.
I'm monitoring the email, and there are questions being asked through the chat forum through the live stream. So Gina's cutting and pasting and setting in my way. Another question, does a dependent that is in 20s have their own HSA, or is the HSA a family amount?
So there are ways to have your own account, but I would say the best thing would be to talk to your tax professional about, we can help you individually, but you just have to make sure that you're not contributing more than the maximum.
And to clarify, the district is making that contribution to the employee's HSA account.
Correct. So if your dependent has their own HSA account that they contribute to, the district will not be contributing to that individual account.
I believe that's it for now. Well, we are going to do our best to go through the questions that were submitted and type up a Q&A type response for everything and then send that out so everyone has access to all the questions asked and the answers that were given. Also a reminder, the live stream will be placed onto the website here within a day or so.
Less than that.
So look for that. That'll be posted, I would guess, under the EBT section. So that will be there for each of us to reference for however many times we want to look at it and see if we can answer our own questions through that. And then if not, I will say, I believe your contact information, Stephanie, was in the enrollment guide, if I remember, the benefits guide that was sent. The two attachments that I sent to everyone was the PowerPoint presentation as well as the benefit guide. That, I believe, on the very last page has a bunch of different contacts listed, Stephanie being one of them with ECA.
And there is a lot more detailed information in that benefit guide. So be sure and look through it. If you have other questions, either Bob or I, both he and I are both listed in there, are available to answer your questions anytime.
Well, we thank you for taking the trek down here from Bullhead, I believe it was.
Yep.
And thank you, Gina, who is typing away like a mad woman over there, trying to get your comments over here so that we can, your questions, so that we can have them answered. Thank you, staff, for being here virtually and being patient as we had to resubmit that link to you. We love technology. It's a great tool. It's helped us to continue to work as best we can and to get information passed out to everyone while also respecting social distancing at this time. So if there are questions, please go ahead and you can continue to ask your questions. I would ask that you just email Sherry and Benefits or myself, and we will do our best to keep answering those questions during this time of transition. So thank you everyone for joining us.